Welcome to For the Record. I'm Shannon Perrine. Today, we catch up with a Pittsburgher we've introduced you to in the past. A man who lives his life at the confluence of science and the arts. Raymond Vennare, the CEO of Predictive Oncology. It was almost exactly 2 years ago, in May 2023, when I showed you how his lab uses artificial intelligence to help cancer patients. Today, we learn a bit more about that, as well as Vennare's other passion, painting. As I interview him at his studio, let's start by getting an update on his company and the work they do. So when last we met, which was almost a couple of years ago now, yes. We were talking about getting cancer drugs to market as quickly as possible with your company that's right down the road. Can you just give us a little bit of an update on how Predictive Oncology, how that work is going?
Sure. As a reminder, Predictive Oncology utilizes artificial intelligence to drive early stage drug discovery, very early stage drug discovery. And the purpose of that is to be able to get drug candidates into clinical trials sooner rather than later. So we do that by modeling in the computer and then testing in our laboratories. And we have been able to show, most recently, that we can shave almost 3 to 5 years off the development process for early stage drugs to get them into the clinic. We've done it as little as 3 months.
Yes, and since we've spoken, how have things been? That work is progressing. It is about to be acquired, which isn't the important thing is what's going on with the work that the people are doing inside that building.
The work continues. One of the reasons, so yes, you're correct. We were recently approached about an acquisition. That acquisition is in discussion right now. We're moving forward with that. The reason that we were approached is because our platform, our technology, in and of itself, the artificial intelligence platform technology is one component, but we have in our CLIA laboratory, which is FDA basically certified laboratory, so any work that we do there can be used in clinical trials. One of our core assets is that we have 150,000 live cell tumor samples. That is the same as having 150,000 patients in the laboratory from whom you can take samples, that's right, with different indications. So we have 150,000 samples across 137 subtypes. Access to human tissue is incredibly difficult and time-consuming and expensive and complicated. We have that asset at our disposal, so we can literally go to the biobank, understand which tumor type we want to investigate, pull that tumor type, model it in the computer, test it in the laboratory, and share that information with pharmaceutical companies.
This is probably maybe even an emotional question, but I just watched our story from before, and a dream of yours obviously is to get these cancer drugs for specific cancers as fast as possible. But glioblastoma, which took your mother, is there specific work going on for that?
Well, I'm glad you asked that question, because one of the reasons I got excited about the company that is acquiring us, one of their subsidiaries has a focus on glioblastoma. So glioblastoma is a death sentence. I mean, let's be honest. And pancreas is not far behind that. So I'm very focused on the rarer forms of cancer that are at the moment untreatable or have limited options for treatment. And it wasn't just my mother, but my brother also passed away from brain cancer. So the exciting thing is, excuse me, the exciting thing is that one of the reasons there aren't as many drugs for these rare diseases is because it still takes 10, 15 years and $2 billion to get a drug to market. But the population of people that have glioblastoma or pancreatic cancer is relatively small. So it's very difficult to get pharmaceutical companies to pay attention to small populations of people because it's very difficult to recoup those, those billions of dollars. Not that they're in any way uninterested in that. They are interested in that. But the advantage of what we do now is if we can model in the computer that drug tumor response specifically for glioblastomas or for brain cancers in general, we can accelerate that, which means you take time out of it, you take money out of it, and you get it into the hands of clinicians sooner rather than later. That's the real advantage of utilizing artificial intelligence, from our perspective anyway.
Yeah, and this company that you're in talks with now is very interested in those kinds of things. And
absolutely.
And that's exciting to you.
Yes, it's very exciting. It's very exciting. We have the tissue samples, they have blood samples. So when you have literally access to that amount of human biological material, it makes it, I won't say easier, but it makes it more accessible to do the work that you need to do more efficiently, more quickly, and drive the development of new drugs as a result. But not just new drugs. We can now repurpose drugs or do drug combinations by testing in the computer which drugs work. So a drug may have been cleared for cardiovascular, which may have properties meaning molecules or compounds, that are efficacious for cancer, but it's never been tested. So it failed in the clinical trial for cardiovascular treatment, but the science still says that those molecules or compounds may be efficacious for other indications. So that's, so your question about data, the significance of data, the more data we have and the more data we can model, the more drugs that we can in silico, we can test against real tumor samples, which is what we have. So the ability to utilize artificial intelligence and access those biological materials allows us to simply identify potentially drugs that have been orphaned or have been abandoned that can now be repurposed, which means you don't have to go through all these you may have to go through clinical trial, but you've identified an asset that can be moved through clinical trials very quickly, because the clinical data already exists.
Still ahead on For the Record.
You had to know the issue, and you had to know why, and you had to be critically thinking about all of those things.
How Raymond Vennare says his childhood set him on a path to discovering both of his passions. Welcome back to For the Record. I want to bring you more of my interview with Raymond Vennare, CEO, biotechnology entrepreneur, artist, and Pittsburgher. We transition now to talking about his enthusiasm about art and how his childhood led him on this unpredictable path. Your face lights up when you talk about this. I can tell that you're excited about it, and it is part of your life's work to do these things and find these solutions to these big problems that so many of us are touched by. And it's interesting to me that you've spent your life, part of your life, like many of us have sort of a path. I have a journalism path, and I've been going down that road for 30 years, but you have a lot of different stuff going on, and as a Pittsburgher, I think it's interesting that we're standing here in your art studio. We're talking about cancer treatments, and we're talking about science and data and AI, but we're in the middle of an art studio. So how did we get here?
So I learned very early on in life, really because of the way my father's perspective and my father's willingness to allow us to do whatever we wanted to do. I won't say not unchallenged, but never really questioned in terms of our intentions and capabilities. He was just a naturally born educator. Everything that he did with us and with everyone he touched was to instill in them the belief that they could do anything that they wanted. He insisted on hard work. He insisted on education. He insisted on purpose. But whatever that education was, whatever that purpose was, whatever that direction might be, he was 100% behind it, even if he didn't agree with it.
Can you give me an example?
Sure. So I actually, it's interesting because of the question you asked. Here we are, a CEO of a biotechnology company being in his own art studio. I actually started out, I thought that I was going to medical school. So I studied biophysics and microbiology as an undergraduate. And I also studied fine art and art history. I did them both at the same time.
In college?
In college, yeah. Even before college, I was always interested in science and the arts. So my path was really, my interests rather were in those directions. When I was a kid, I would go to the Carnegie Museum. They would have the art schools on the weekends. They would take busloads of kids and you go into the main architecture hall and you would draw. And I fell in love with that.
That's one of my favorite places in Pittsburgh.
Oh,
yeah.
It's so
the Hall of Architecture at the Carnegie Museum in Oakland is
so underappreciated. So underappreciated. It's really a gem, not just in Pittsburgh, but I think for the country as well.
Correct.
So I never had to make the decision to do one or the other. It was just what I did. It was just something. Creating a company, building a company comes from the same inspiration, the same creativity as putting a canvas on an easel and painting. It's the same source. It's just a different focus, that's all.
Yeah, and I have kids, and two of them are in college, and I clench up a lot thinking about how they're going to get a 401k and how they're going to put a roof over their head and feed themselves. And parents in general, I think, have that same survivalist instinct with their children about, yes, I want you to do what you're passionate about. I want you to do what you're interested in and be able to make a living that way. But can you please have a plan? So, I'm like, how do we, if you had advice from Alfred, your father, to me about that with our own kids, what would that be?
Well, I think the main thing that he always taught us was to educate yourself, whether you went to college or a technical school or a summer away. Educate yourself, because there is no substitute for education. It doesn't matter what you do in life. You will not progress in life unless you dedicate yourself to understanding whatever it is you're doing. So I think education is key to this. But what he did was not necessarily force education on us or force education on me. He taught us to think, to be critical thinkers about whatever it is that we wanted to do. And when you do that, you sort of self-assess. Maybe I shouldn't say that generically, but you self-assess when you're a critical thinker. When I was engaged in forensics, debate, and my father was, when he was in high school, was in debate. And debate is, you have an issue, you talk about an issue, and then you get up and you debate that issue. Well, what I was taught by my father is, and we did it actually in the house before I ever did it, in classrooms. We would have a topic, and we had to learn about that topic, but I never knew until the minute he started asking questions whether I was defending it or opposing it. So you had to know the issue, and you had to know why, and you had to be critically thinking about all of those things. And the interesting thing in that scenario is that you have to take yourself out of it. You have to remove yourself from that, because the minute you let the emotion into it, or personal beliefs or biases into it, the idea of solving problem goes away. It becomes you're taking a position rather than discussing an issue. So that has stayed with me my whole life. I still believe that to this day.
Still ahead, Raymond Vennare shows us more of his paintings and tells us where he finds his inspiration. Welcome back to For the Record. More now of my interview with CEO and artist Raymond Vennare as I visit his studio and learn how Pittsburgh sometimes plays a role in his inspiration. Does any of that, those places where the people are who you're telling their story, is any of that Pittsburgh?
Yes. I don't know. Well, so you're from Pittsburgh, so you may remember Mayview State Hospital.
Yeah, sure.
Okay.
Yeah, my husband's grandfather worked a farm there and had the residents there actually make food.
Yeah.
Grow food there.
That was a special place for me. When I was a kid, I would go and deliver candy and flowers to the residents there. And I did that because, they were disenfranchised people. They were disenfranchised people. Initially, it was a place they sent what they thought to be, people who could not be rehabilitated, who had mental problems, right? It evolved into something else, I think, that was more honorable, but there was a lot of research going on there. There was a lot of therapy going on there. But I remember going there as a kid, and then years later, when I went back, it had already fallen into disrepair. And I was walking through the building. I can show you the name of the painting here. The name of this painting is called Sanctuary. Sanctuary. I always thought of Mayview as a sanctuary. I always thought about it as that special place where people with special needs could go and feel safe. Sometimes it happened, sometimes it didn't. Sometimes they were taken advantage of, sometimes it was their salvation. And I remember walking through the cafeteria, and the cafeteria had been painted with the old lead paint. Yellow and gray over yellow and blue over gray and white over gray. And I was just struck by the place because it was just, when I walked into the room, the tiles were on the floor, the wall had peeled. And this is exactly the feeling that I had. The cracking of the oil paint, of the acrylic paint over the oil paint over the plaster, and it all started to separate. But these are the real colors from the cafeteria itself and the hallways walking to the cafeteria.
What do you mean they're the real colors?
I took color samples from the building.
And you matched?
And I kept them for years. I didn't do this painting until a couple of years ago, but it goes back to that experience.
And the colors of the walls in Mayview's cafeteria are telling a story. And not just the colors, but how they're applied and removed.
It's the story for me of the people who, the communal experience of living in that space. When I walked in, smoking was, everybody smoked, right? Including the physicians who were treating the patients. So everything was yellowed. That yellowed sort of nicotine sort of smell and look to it. So when I walked into that room, that memory hit me like a bolt of lightning. It was that, okay, this is what I felt when I was there. I wasn't rendering that space. I wasn't rendering the cafeteria. I was capturing the experience that I had when I was there years ago. So I was capturing the emotion and the experience of it. So the colors, some people see this and they think it's very drab. And they are right. And could be very depressing. For me, it's exhilarating because the way I felt when I was there, I felt like I was helping those people, right? And I did feel sad when I saw it in ruins, but I had very good memories of what it was like to be there when everyone was there.
Keep it right here. We'll share a final thought from artist and CEO Raymond Vennare in just 2 minutes. Welcome back to For the Record. Before we go, I did ask artist and CEO Raymond Vennare for any final thought or message for Pittsburghers who want to experience and learn about the arts. Listen to what he had to say.
You know, I don't want to be presumptuous about it, but I think don't be afraid of your own opinions and your own emotions and your own willingness to experience things. I think there are two camps. I mean, people just decide they don't, for example, modern art. I don't understand modern art. I don't like modern art. You know, anybody could do modern art. Well, good luck with that. I mean, if you want to really try to do that, I think it's a reasonable assumption. But that shows me that you don't either believe that you can or that you aren't willing to put the time in to learn how to do it or learn about it. And the other is, you know, what I said earlier about I've never abandoned that childlike inquisitiveness that was instilled in me. So I think I think everyone should go to the museums. Everyone should experience museums. We're talking about the visual arts, but I believe that with music. I mean, people like jazz, people like classical, people like pop. Fine. Expose yourself to it. Reading. I can't say strongly enough how important reading is. Read every day. Read something. Read an article. Read a book. Read a paper. Read a magazine. Read. Get someone else's perspective, because when you understand that there are other perspectives out there, your perspective may change as well. If nothing else, there's a point of reference where you're going to have a dialogue with someone.
And we have a link to Raymond Vennare's website where he describes himself as an artist, a writer, and an art historian. It's available right now at WTAE.com and the WTAE app. Just click the link for this episode of For the Record on the main page. That's all the time we have for today. We'll see you next Sunday morning at 11:30. Thanks for watching.